Thank you very, very much for that warm welcome. I feel it is a real privilege and an honor to be here, and I would like to thank Rolf van Dijk and the Center for Leadership and Behavior in Organizations and Sparda Bank and Herr Weber for inviting me to speak here today. And most of all, I'd like to thank you for giving me the honor of speaking with you, and the honor of allowing me to influence maybe your thinking about how we develop and how we nurture really effective organizations. So from my heart, thank you very much indeed for inviting me. What I thought, thank you.
Is the microphone on?
How's that?
Okay.
Okay? Can you hear me? Can you hear me at the back? Yeah, it's okay. So what I would like to do is to take some of your time to talk about these topics. I want to talk about how we create really effective organizations. And I think that the starting place has to be what the organization is for. So we have to be focused on customers, and that's, I think, the first issue. And then to talk about, okay, but what beyond that in order to ensure that we can be really effective? And I think it's to do with ensuring that within organizations we have really clear goals at every level, from the top management team down through departments, down through teams, down to the individuals within the teams, that there are aligned objectives at every level so that we all know what it is we're required to do. I think we also need really good people management, and it's an easy phrase to trot out, but many organizations, unlike Sparda Bank, don't provide training. They don't have satisfied groups of employees. And good people management, I think, is about making sure that people are clear about what it is they're required to do at work, and making sure that they feel valued and respected and supported within the organization. And I think for me it's also about creating a situation where employees feel engaged, that there is a sense of engagement and vigor and dedication and pride in what they do, both in relation to their individual work, but also in how they interact with the organization that they're part of. And part of my thinking about this is that organizations, I believe, are simply another form of human communities, just like a village or a voluntary society or even a family. It's a form of human community, and we have to understand them as human communities in order to ensure that they're most effective. I think also, you know, when you listen to the quotation that Rolf read out about our early history, that teamwork has been part of our history throughout our evolution, and we have to harness the energy of teamwork within modern organizations, and I believe that we are very often failing to do that, and I want to challenge some of the ideas we have about team working in organizations. And finally, to talk about really that I think if we are going to create effective human communities, that our leaders must embody the values that are fundamental to effective communities, that we need to lead from a value base first and foremost, rather than from an abstract intellectual conception of what leadership is about. So I want to check, have you come to the right meeting? Yeah? Okay. Let me begin by sharing with you some of my prejudices about what leadership is about. First, I think that leadership is about searching for new ways to add value for customers. And I'm sure you will all agree with that. But I think that when we think about it, means a lot for our individual behaviors. It means that we have to remember as leaders what we are here for, and that we think about almost every hour, every day, every week, how can I add value for customers? How can I ensure that the teams I lead are adding value for customers? Rather than engaging in lots of other activities which feel like they're leadership or feel like they're important things we should be doing at work, but are not maybe making any difference at all to customers' experience. And that, I think, requires us to remember that we are leaders every day, every hour, every week, to remember that we're in a leadership position. And second, I think what's important from a leader is to be optimistic and confident that there's no problem that can't be solved, no status quo that can't be bettered. Because if we as leaders are not optimistic and confident about the changes that we can bring about, then surely the people we lead will not be confident either. And that, again, I think, requires us to be aware. So when I, as a leader, come into the workplace on a Monday morning, maybe not having slept well or whatever, and I feel tired, and I know that I feel tired and down, that's what I know. But the people that I lead think, what have I done wrong that he is in this bad mood? So it is about, again, although we agree with ideas like this, it's about remembering that we are leaders every day and remembering to play that role really effectively and genuinely. And the third is about really, I think the role of a leader is to really try to understand what customers want. And again, this is a phrase I'm sure none of you would disagree with. The role of leaders is to really listen to customers. But what does it mean? Let me give you an example. This morning, I'm leaving, let's say, to get to the airport, get in my car, get to the airport, come to this really prestigious meeting. And I'm very anxious, I want to be on time, I want it to all go perfectly, and I have a flat tire in my car. And so I change the tire and I go very quickly to the tire repair place. What is it down the road? Pit stop, I think. What is it that I want from them? Sorry? Change my tire? Mobility, yeah. A solution?
Fast.
Low price? Quick. Yes, please. A good coffee, that would be nice. Yeah, that would be really nice. I want them to understand that, maybe some empathy because I'm feeling very tense. Maybe some foot massage even, would be really nice. Yeah. Do you know what I would really like is if they would fix it so I never have a flat tire again. That would be great, because it seems such a crazy thing to happen, and it's so disruptive. My hands are covered in dirt and all the rest. Please fix it so I never have a flat tire again. So when we talk about listening to customers, from a leadership perspective, it seems to me to really think deeply about how could we make a big difference. And by the way, I gave this example last week to a group of people, and somebody put their hand up and said, this is totally unrealistic. And then somebody else put their hand up and said, I have a RAV4 car and the tires don't go flat because they fixed it so it doesn't happen. So do you know what I mean about thinking really, really creatively and differently? And the final point is that I think leadership is about doing the difficult rather than managing the inevitable. So it's thinking about what is really going to make a difference to the effectiveness of this organization. What is it that I need to spend my time doing that's really going to shift the organization in the direction we need to go, rather than what we can all spend our time doing as leaders, which is to go to lots of meetings and to do lots of emails and send lots of other emails. What is it that I can do that will really shift the needle? And again, I think that what that requires, all of these things require, is, if you like, mindfulness of remembering that I'm in a leadership role every hour, every day, every week, every month, and thinking about what do I need to be focusing on, how do I need to be behaving in order to make a difference for the organization. Does that make sense? Yeah? So, for me, that's all about people. It's about how we work as leaders in our relationships with people. And I want to really demonstrate from our research evidence, and Rolf was talking about the importance of research evidence guiding our thinking. And for me, one of the most exciting periods of my professional life, probably the most exciting period was when I, as a psychologist, came together to work with a group of really strange individuals called economists. Do you know? And I laughed too, actually. Yes. and it was just incredibly exciting because my ideas were challenged, and I had to think in completely different ways and communicate in different ways. And I worked with these economists at an institution called the Centre for Economic Performance at the London School of Economics, and we conducted a 10-year study of 160 manufacturing organisations across the United Kingdom, interviewing senior managers, the chief executive every 2 years, surveying the staff, gathering data on financial performance, innovation, and so on. And what we discovered was that the best predictor that we could find of future productivity was basically the satisfaction levels of the employees. So, of course, there were other factors, but really what mattered was how satisfied, on average, the employees were across the organization. So as Herr Weber said, you know, where you have a generally satisfied workforce, you can almost in a sense guarantee the likelihood that your company will do well. And when we looked at the management practices that really made a difference to performance, we found in terms of emphasis that again it was human resource management practices, the extent of human resource management practices and the sophistication of those practices which predicted the subsequent productivity of the companies as we followed them through over time. We then decided to extend our work to look at the service sector and to take the biggest set of organizations in, I think in Europe, in the English National Health Service, 1.4 million employees. And we looked at 61 hospitals in terms of their performance in delivering care for patients. And what we found was that, again, measuring the human resource management practices in the organization, that gave us the very best predictor that we could find of patient deaths, of patient mortality. We could account for nearly 18%, 17 to 18% of the variation between hospitals in levels of patient deaths on the basis of a knowledge of how they managed people within the organization. This was a better predictor than the number of doctors per 100 beds, a better predictor than family doctor facilities per 100,000 population, a better predictor than the profile of diseases which people attended the hospital with. And even taking account of the prior mortality data in hospitals, we could still account for about 8% of the variation between hospitals in patient mortality. If those relationships are causal, then we could say that by increasing, just to go back, if those relationships are causal, if we could train 25% more of those who do appraisals in how to have effective appraisal conversations, that would be associated with 12% of the number of deaths after admission for hip fractures. More people working in teams, 25% more people working in teams would be associated with 7% of the total number of deaths following emergency surgery. Somebody said recently, well, 7% isn't very much. And of course the answer is if you're one of the 7%, it's quite a lot actually. Yeah.